Let's kind of look at that MCA as a hub for wellness. The MCAs have been a hub for change for 911 dispatch to standardize that across the state. It's helped correctional facilities and law enforcement with engaging more in the medical side of accessing patient care for those people. How do you see Michigan's MCA system providing another avenue to connect all first responders and their families to like mental health resources we're talking about to complement programs such as FST5?
I think people need to remember is that the MCAs fall under the public health code. And that is what we did leverage here in order to help build on that, to find out what resources they had, which led us into the Detroit Wayne Integrated Health Network and also the Zero Suicide Council. So those are resources we were able to pull in and become, like you said, the hub that we can then give that information out to our first responders.
Give us a little more background on that, because as an MCA, this sounds like a great idea to reach out to your public health, your county, your system public health, why you did what you did and how maybe others can take the lead on something like it.
It was just a natural fit because, again, we fit underneath the public health code. Part of our goals of reducing, cardiovascular injury, strokes and all that, that is also their goal. So going on different fairs with them and health outreach is awesome. And from there, that can expand into mental health resources as well.
Building on what Damon's saying, so the MCA is the only place where all the agencies come together and are in front of folks and in front of public health, and we've got support and connection with law enforcement and emergency management. So it's a natural place to be a hub for resources. So when working with the various community mental health in Wayne County, that's the Detroit Wayne Integrated Health Network, but also they work with a ton of different community-based groups like Frontline Strong, like various substance use disorder treatment programs like Face Addiction Now or SHAR, Sobriety House. I mean, a ton of things in our state, and every state really, are done by non-governmental organizations. And having one kind of clearinghouse for that information is a great job for the MCA. Plus, the MCA has a lot of credibility across all the disciplines you mentioned before with law enforcement and everything else. People tend to come to the MCA when they have questions or they need training or they have a community group that needs training. They come to the MCA. So people are thinking about it as a clearinghouse. It should be a clearinghouse for behavioral health and, substance use disorder and support for everybody who's out there.